Hello, folks, and welcome to Bayer for Health India podcast, Health Heart Matters. My name is Amit Gupta, and I am the lead digital marketer from Bayer. And along with me, I have Dr. Sadanand Shetty, who is a renowned and a leading cardiologist based out of Mumbai. Today, we will be discussing about chronic heart failure, what it is, how modern treatments can help, and why patients are still at risk despite getting treatments. And last but the least, why interventions are necessary. So, folks, as per stats, India has one of the largest heart failure population in the world, and Indian patients are developing heart disease almost a decade earlier than the Western counterparts. But before we dive deeper into it, it's important to understand what heart failure really is. So, Dr. Sadanand, if you can just help us and simplify what heart failure is for our viewers.
Heart failure is a condition in which the heart muscle cannot pump enough blood to meet the body's need for both blood and the oxygen. Basically, the heart cannot keep up with the workload of the patient's work activities. And the common symptoms are shortness of breath, ankle swelling, reduced exercise tolerance, fatigue and tiredness, and longer recovery after the exercise. So also lack of appetite, nausea, increased heart rate, weight gain from fluid buildup, and dizziness or lightheadedness are additional symptoms. If you have heart failure, it is important to know the symptoms and keep track of the symptoms for further the detailed analysis whenever we see the doctor.
Thanks a lot, Dr. Sadanand. So, just a follow-up question. So, when you talk about all of these different factors, I just wanted to know, one thing comes out is the variation in blood pressure, which is coming out. So, apart from the variation in blood pressure, are there any other causes, maybe a CAD disease or some kind of lifestyle issues? So, if you can just highlight other issues as well, which causes heart failure, that would be great.
Yes, the high blood pressure is one of the common, the condition giving rise to heart failure. Besides that, coronary artery disease, which happens when the blood vessels that supply the heart muscle become narrow or blocked, and usually due to the fatty deposits, which is a gradual process right from the initial years of life. And these are the other very, very important cause of heart failure. Other risk factors including overweight, obesity, type 2 diabetes, smoking, and the high cholesterol are the other additional comorbidity in such patients, which ultimately give rise to heart failure.
Yes, sir. So, sir, we understand now what heart failure really is. But, one thing comes to my mind is, are there any stats around what kind of challenges does a heart failure patient faces in real world?
People who have recently had heart failure episode are at higher risk for their condition getting worse. So also nearly 73% of the patients may face readmission or death 1 year post-discharge. As a matter of fact, 5-year survival of the heart failure victims were less than 50% earlier. So this heart failure was almost compared to the malignancy or the cancers. But today, with the advent of good guideline directed medical therapy, it is improving. The risk of death is higher after every heart failure hospitalization. So our interest always is to prevent recurrent hospitalization. Each recurrent hospitalization for the heart failure significantly increases the risk of death and underscoring the urgency for prompt intervention. So friends, once a heart failure comes, we have to prevent the recurrence, and that's the whole important aspect of the heart failure therapy.
Thanks, Dr. Sadanand. And one thing you touched upon was the basically about the treatment of HF. Now looking at all the medicine marvels and all the different things happening around, can you just explain in brief what are the treatments for heart failure?
Yeah, today we have got, definitely last over 1 decade, the treatment of heart failure has improved considerably. A lot of, the new medication and the new drugs, and we give them in what is called a GDMT fashion, which is a guideline-directed medical therapy according to the standard guideline, European, American, even for that matter, Indian guideline. And it is a combination of medicine which ultimately used for the management, and that has shown to minimize, lower the incidence of hospitalization and the death in people with heart failure. So essentially these particular drugs, commonly 4 group of drugs, and now importantly the 5th, what we call, like from quadruple, we go into quintuple therapy.
Great, sir. So one thing came to my mind when you're talking about quadruple therapy and all. So basically, there are many heart failures happening within a person. So, despite the significant advances in medical treatment, many people or many patients with heart failure continue to deteriorate. Why is it actually, doctor?
Yeah, that's very important part of the heart failure therapy, because basically heart failure is usually a chronic condition. The course of the disease is characterized by the periods of deterioration of the clinical condition, and patient can go into acute deterioration called as an acute heart failure. And after the correct treatment, the recompensation, improvement, and the stabilization of the clinical condition do occur. And even when patient is better, the heart failure condition remains, underlying, known as a chronic heart failure. So the course of chronic heart failure is a dynamic process with the periods of, like acute deterioration, and at times patient is stable, and this can suddenly get worsened. So what we call as a stable heart failure is no more stable. There are always, risk and the chances of getting to deterioration depending on multiple reasons, and that is why it is important to maintain, and we have to be cautious.
That's insightful, sir. And adding to this, there is also a growing realization that chronic stable heart failure is misleading right now. Even if symptoms have stabilized or no longer evident, can you elaborate on this?
Yeah, this is very absolutely right statement. A progressive condition that usually gets over time and can get at times very serious, even though treatment has improved a lot, particularly in the last decade or so. Therefore, stability with the current treatment, patients remain at higher, what is called a residual risk, and that ultimately land up in hospitalization or even the death. Let's say that 1 in 7 patients remain for such adverse events in 18 months after the birth. So importantly, when patient gets acute heart failure, the initial are very crucial, and initial years is still more crucial, because that where you have to minimize the hospitalization and also the morbidity, patient's clinical symptoms, etc. So we have a tremendous, the response and keeping the heart function under check all the time.
Yes, sir. So I heard that you were talking about residual risk. So what actually is residual risk?
Evidences shows that the rate of hospitalization and cardiovascular death remain substantial with the guideline directed medical therapy in the real world practice. For example, in the DAPA-HF heart trial, it is shown that patients treated with the dapagliflozin still experience CV death or hospitalization for heart failure at an annual rate of about 12 per 100 people, necessitating the need for the other novel intervention. So in simple term, it means whatever standard quadruple four drug GDMT we are offering, there is still a residual risk. So we have an opportunity to minimize that, and that is why we have to think of something new, novel molecule, which will be like a fifth pillar or a quintuple therapy in heart failure patients, both for reducing the morbidity and the mortality.
Yes, sir. Thanks a lot. That was quite insightful. One thing always come to my mind that prevention is better than cure, and when we talk about medicines as the foundation, it also requires a lot of lifestyle changes. And if you can, and I believe that and it is also proven that lifestyle changes can make a huge difference in heart failure. Doctor, could you throw some light on this before we close?
The lifestyle is one of the important, the part of the cardiovascular therapy in general, more so in heart failure, because we need to be very, very, aggressive about the lifestyle modification, and therefore quitting the smoking if you are a smoker, taking medicine as prescribed, not to skip the medicine, so adhering to the therapy, wait daily to watch for any sudden weight gain, which means there is a water retention, and take the fluid intake as much as required, daily fluid intake. Sometimes we may advise 1 minute at 1.2 liter, etc. Monitoring the blood pressure also is very important daily, and loss or maintain your weight based on your healthcare professionals' recommendations. Avoid taking alcohol and the caffeine, and basically following the heart healthy diets are very important. Sodium intake, salt is one of the important reasons for heart failure, precipitation, etc. Activity, physical, whatever is comfortable, we need to be regularly doing, and also enough rest, sleep, etc. are important part of the lifestyle therapy, and it is very important as an important role in heart failure patients.
Yeah, thank you, Dr. Sadanand, for taking the time to join us today and sharing your invaluable insights on worsening heart failure. And I do believe that our viewers will surely come to know more about heart failure, and they can have the right questions if they have, and to ask to the doctors. And to our audience, we hope that this discussion has been informative. Please remember that the information that doctor has shared today is meant to raise awareness around heart failure. It is not a substitute for professional medical advice. And if you know someone, or if someone in your family is experiencing these symptoms or has been diagnosed with heart failure, it is crucial to consult with a qualified healthcare professional. Always follow the guidance of your doctor and seek medical advice for any health concerns. And finally, a very big thank you to Dr. Sadanand for throwing light and giving us a lot of insights around heart failure. To stay updated on more such discussions and health-related content, be sure to follow Bayer for Health India on Facebook, Instagram, and YouTube. Thank you for tuning in, and we will see you next time.
Thank you. Yeah.